Justin Lubino with Senior Advisors, and we've launched a new web series called Coffee with Justin, and we're really excited about this. They're going to be short episodes, anywhere from kind of 10 to 20 minutes, with a variety of different guest speakers from different backgrounds. Some of them are going to be clients of ours. Some of them will be financial advisors, insurance brokers. We may have legislators and doctors and so forth. And on today's episode, I'm excited to introduce, we have Dr. Stephen Marcus and Amy Marcus, his wife, who have been clients of ours at Senior Advisors since 2016. And we're excited to have them on the episode. Thank you for joining us.
You're welcome.
The way we start out these episodes, we're going to start out with kind of some silly coffee questions just to kind of break the ice. We are doing Coffee with Justin. So, the first couple of questions here, there you go, are around kind of, your coffee habits. There we go. We got some mugs there. So I guess the first question is, what's your kind of go-to coffee at home? Is there a specific type or brand you like to drink?
I actually only use Kirkland brand decaf in the bean, and I have to get it by mail because they don't sell it in Costco anymore. In the store, and it actually is roasted by Starbucks.
Oh, I didn't realize that. So the Costco is okay.
Mm-hmm. Roasted by Starbucks. You can get the regular beans in Costco, but not the decaf beans.
And I dunk into it a double or a quadruple espresso. And I buy that in bulk beans also, but from Wegmans.
Nice.
They I don't know who roasts their coffee, but it's a nice, strong, hearty espresso bean. But we only grind our own beans.
Good. Get the freshest flavor that way, I guess.
Mm-hmm.
So Amy, you're purely decaf, no caffeine?
I have to be decaf. If I have anything caffeinated, I shake the rest of the day. So I have to be very careful. Mm-hmm.
Got it. How many cups a day normally for the two of you?
For me, it's 1 a.m. I stop drinking coffee after breakfast.
Got it.
Except in the summer, I'll have an iced decaf coffee for lunch.
Got it. And you, Steve?
Let's see. I would have the coffee with a double in the morning. Then usually around this time, I'll finish up what's left in the pot from breakfast. I'll almost always have an espresso at night after dinner, at least a double, if not a quadruple.
And he sleeps.
That's amazing. I'm with you. Yeah, I can't do anything afternoon with caffeine. I'm cheating right now. I've got a tea here, decaf tea that I'm.
Oh, okay.
Truth
be told.
Well, every now and then I'll drink tea. We brought back some absolutely fabulous Kenyan mountain tea from our trip to Africa last year, and it's absolutely spectacular.
Nice.
The best
Africa.
Was
that you did the safari and everything?
We did. We got back into the country on March 8th, and the country closed down March 12th. So we managed to get our trip in last year. Mm-hmm.
That's great. That's great. You got to do that.
Mm-hmm.
So, all right, last coffee question for now is, if you could have a cup of coffee with anyone, who would you choose to have a cup of coffee with? With each other. All right. All right. Good answer.
Yep.
Good answer. All right. I like that. So tell us just a little bit, about your history. How many years have you been married?
It will be 53 years in August.
Wow, that's great.
Yeah.
Congratulations.
Thank you.
Awesome.
Mm-hmm.
Do you remember how you met?
Yes. You want to tell them?
No, you can tell them.
Our fathers our fathers went to college together, and
Fraternity brothers.
And were fraternity brothers and remained friends. Stephen unfortunately lost his parents very young, but his stepmother bumped into my mother in New York. They were both teachers in the New York school system, and they were waiting online to break another strike that the school districts had. And they got to chatting, and Ray said to my mother, "How is Amy and Phyllis?" And my mother said, "Well, Amy just graduated from college in June. She, was living in the city." And a few weeks later, a week or two later, Stephen called me. We didn't know each other. He's 4 years older than I. He's my sister's contemporary.
Okay.
So
Nice.
I didn't really know him. He was out of the high school when I went in, and so on. And so we went on our first date that September. We were engaged in December, married the following August, and 53 years later.
That's great. So you actually grew up in the same town, in the same area?
Well, different parts of Brooklyn, New York, but the same city. Mm-hmm.
Nice.
Same
Very
high
cool.
school.
Probably no more than around 10 or 12 blocks from each other.
Right. Very interesting.
But in Brooklyn, 12 blocks was a different world.
Different. Interesting.
Her family lived in a private house. They were rich.
Stop it.
Well, it's nice. Your parents were the matchmakers, it sounds like. That's
Basically. Mm-hmm.
yeah, that's great. And you have kids, grandkids? What's the story?
We have 3 children. We have a 50-year-old daughter, a soon-to-be 47-year-old son, and a 42-year-old daughter. So we have 3 children and 8 grandchildren, 4 boys, 4 girls. The oldest sophomore in college, and the youngest is 2 years old.
That's great. Are they the grandkids local? At least some of them, or?
Our son is local.
Define local.
Yeah, well, our son is in Scotch Plains. Our
Oh,
oldest
yeah,
daughter
there you go. Good.
in Cinnamon, New Jersey, and our youngest daughter lives in Bethesda, Maryland. So to us, that's local.
Yeah,
It's a car ride away.
That's
Mhm.
great. Good
Yeah.
stuff. Good
We
stuff.
are very blessed.
So just to shift kind of a little bit to kind of your professional lives, and I'm just curious for the audience, just to kind of, you could share for us your backgrounds. I know Stephen's a doctor, and and if you want to just kind of give us a little background, maybe starting with Stephen, and then Amy, on your professional experience.
Sure.
Okay. Well, I started out my career, if you want to call it that, as a pharmacologist. When I graduated from college, I started to work as a pharmacology assistant at New York Medical College. Went to medical school and kind of bounced from subject to subject, eliminating things because I didn't like this and I didn't like that, and ended up taking a residency in pediatrics. And I wanted to do pediatric and human pharmacology, but Uncle Sam had some other ideas. So after residency, I was kind of conscripted, although they claim I volunteered, but we spent 2 years in the Navy. And I say we because I was lucky enough during the Vietnam War to be sent to Iceland, which they considered ship duty. So that we spent 2 years, but I had Amy with me for both of the 2 years, and we actually had our first child born there.
That's awesome.
That was kind of an interesting experience. I think we learned a lot about each other, and I learned a hell of a lot about medicine because you really didn't have anybody to help you.
Wow.
You were kind of on your own.
You were practicing in Iceland?
I spent 2 years as the base pediatrician, and we had about 6,000 active duty servicemen and 6,000 dependents, and about 1,000 kids. So it was a very busy practice. It was exciting because we really learned to do things on our own. We had a delivery of a set of twins, and at that time we had no ultrasound, so the parents had no idea that they were going to be twins. And the father was sitting in the waiting room, and I went running by with one kid to put the child into an isolette, and I went running back, and he said, "Why are you running?" I said, "We'll talk about it."
Buy one, get one free.
It was kind of exciting. And when I came back to the States, I had a choice of a few jobs, and Amy kind of chose which one we would take. She didn't like some of the choices that I had.
Living in Indiana wasn't on my top 10 list at the time. So
and
yeah.
one was in farm country.
And
she didn't see herself on the back of a plow or something. So I took a job, but that was going to be temporary, with an old friend of mine from residency in Newark, and stayed there for over 30 years.
That was at Newark Beth Israel Medical Center. Yeah.
And there I kind of reinvigorated my interest in pharmacology, and took a fellowship in Boston in medical toxicology. And literally, I would fly up there every week and fly back. I'd spend a day or two in Boston, and the rest of the time I would work full time, and became a medical toxicologist, and developed the Regional Poison Center for the state of New Jersey. And that's what I spent the rest of my career doing. And it was a heck of a joy. Amy used to get upset because I would come home and tell about the terrible cases that I saw that were interesting, but it was an exciting time. I accomplished a lot, and it was a nice run. I only left because the university really started giving me too much of a hard time, telling me I didn't know what I was doing, although I was raising $4 million a year in grants. They didn't like the way I was doing it, and after a while, our financial advisor said, "Steve, you don't have to work anymore. If they're driving you crazy, then leave." And that was
2016.
about
July 1st.
2016.
That's when reached out to you.
And we reached out to you a couple of months before that. I started looking for, how am I going to cover my health insurance? I hadn't worked for the state long enough to qualify for free health care. So I knew I wanted to take some supplemental insurance above the standard Medicare, and I had no idea what it was all about. So
We needed a teacher.
yeah, and
That's
so
where we came in.
That's
Right.
where you
That's
came in.
where you
Yes,
came in.
Yes.
So just a couple questions for you on kind of some of that background. So in Iceland, were you able to see the Northern Lights at all? Did you do?
Oh, I've got some photographs of it.
Okay.
And that era, you have to understand that it was film. So you didn't know what you captured on as a picture until it came back.
You're talking the early 70s.
Yeah.
Our daughter was born in 71 and we came home in 72.
Yeah.
Yeah, we've got, yeah.
Did the
So-
pictures do it any justice or no?
Mine, man, it's interesting because I took them, but we never saw the variations in color. They were always green, but it would look like these giant screens of green colors that you could see them moving and stuff. And it was exciting. It was a very, very interesting. It's a beautiful country. It's a lot prettier now than when we were there.
Yeah.
When
I had
we
the
were there, there were no
opportunity.
trees.
I had the opportunity to go about 3 or 4 years ago, just for about 5 days, 6 days.
That's all you need.
Yeah, it was. I mean, the food was great. The people were nice, and it was just we got to do. There's like those natural springs thing that we got to do that, and but the one thing I didn't get to do, which I regret a little bit, is the Northern Lights thing. But I think some people that did the tour actually didn't get to see them, so they went all the way up. And then
most people go during the summer, so you don't get to see the Northern Lights. When we first got to Iceland, our biggest problem adjusting was that it never got dark. So we would be at somebody's house, after dinner and stuff, and I'd look down at my watch. It'd be 2:00 in the morning, and I had to be in the office at 7:30. And I'd say, so we ended up putting aluminum foil on the windows
Yeah, we
to
needed
black out the
shades.
sun.
We went back 5 years ago with a couple that we were stationed with there.
Nice.
And it was a hoot. We had a wonderful time reminiscing and seeing where we had lived and where they had lived. And Stephen still has 2 physicians who he maintained a relationship with, brought on the base. Icelanders, and they met us at our hotel for drinks. And it was just, it was wonderful. It was 2 years out of our life. 2 years, Stephen was 2 years behind his colleagues in terms of trying to look for something to do in the States. But I don't think we would have traded it for anything. It was either there or Vietnam, and we were lucky.
Right. Yeah, absolutely. Absolutely. That's great. And maybe just to shift a little bit to, I know you had authored a book as well, Stephen, and then we'll hit on Amy's background as well.
Don't worry about me.
Yeah.
He was the breadwinner. No, that's not true.
People used to say, I had such great experiences, and I really should put it together. And when I started medical school, we got a reading list, and there was a book by Bertrand Ruchet called 11 Blue Men. And it was my guide to how to practice medicine. He wasn't a physician. He was an author that wrote for the New Yorker magazine, but he had these wonderful, like, detective articles that he published in the New Yorker and then put together in a book. And I said, okay, that's what I'm going to do. And I spent, I don't know how many years writing it and fixing it and what have you. And finally, the Springer company said they want to publish it. And then I spent, I guess, another 2 or 3 years hashing all the details out with them and some of the legal problems of using real cases. But there are 14 of my most famous cases of medical detective work. And it got published in 2017 in March. It's called, they made me use their title, but I couldn't really choose mine because of the way they market books nowadays. It's called Medical Toxicology, Antidotes and Anecdotes. And I like the idea of the Antidotes and Anecdotes because it was more of a catchy thing on how I managed to crack the code on certain cases, and including the case of Charles Cullen, the nurse that went from hospital to hospital killing people. I was the guy that blew the whistle saying there's something wrong at a particular hospital. faced a lot of grief over the next 4 or 6 months, but that's one of the chapters in the book.
Wow, that's great.
And for me, the non-medical person, and even for our own kids and friends of ours who've gotten the book, they're detective stories. It's like CSI, and I remember the cases, which is exciting too. And I also help to edit the book in terms of Stephen's grammar and spelling. But it's something that I think medical students, pharmacy students should be reading as part of their education. And every March we get a royalty check, which is nice.
There you go. That's a nice little annuity there.
Yeah.
Could you repeat the name of the book just for the audience one more time?
It's called Medical Toxicology, Antidotes and Anecdotes.
Great. And where can they, is it on Amazon or where's
on Amazon? Sometimes Amazon is a little funky as far as how they ship the books or something or other. Books nowadays are published on an as needed basis. It's not like they have this huge run and they're sitting on the shelf. So most people will find it faster to get from Springer.
Okay.
Springer Publishers.
Springer Publishers.
If
people have a electronic access through their local library, or if they happen to be associated with a college or university, they actually might get it for free through the library.
Okay, good. Well, we'll publish a link with the video so folks can find it if they want to get that book. It sounds very interesting. I'll grab a copy myself as well, and sounds like some good reading. So
it really is.
Amy, maybe you just if you want to share a little bit.
I was a high school teacher in Brooklyn, and then we got shipped over to Iceland, and I did some subbing there even after Jamie was born. And when we came back to the States, I was lucky. I stayed home with our oldest and our middle child, Joshua, for 10 years. And then I looked at Stephen, I got to go back to work. So I was a councilwoman in South Orange, New Jersey, and I was also very involved, and I was president of the Chamber of Commerce. And so I walked into my little local bank and I said, I need a job. And he said, what do you know about banking? I said, 2 things. You put money in, you take money out. And actually the president of that small bank created a training program for me. Ultimately, I morphed into a training director of a large institution. And I had a staff, and we did sales training and soft skills training. And I hired people to do the more technical training. And I spent over the last 30 years of my career in banking. Okay. And loved every single minute of it. And then in 2010, the bank morphed into another bank, into another bank, into another bank, and they laid off 1,500 of us. It was the best gift I could have been given. And my former boss called me within 2 months and said, I need you, but only as a consultant. I said, I don't want to go back to work full time. And so I have had this one client for over 10 years, and I got 2 or 3 other clients. I had a client in New York and in Brooklyn and Queens. And until last March, when the pandemic hit, I was still doing training for them. I designed their sales training program and proprietarily, and I have been doing all their sales training and some other training for them for over, for 10 years. Last March, we came home and I was supposed to train and got a call and saying, we're not doing live training anymore. So I had a good run. I really think, my career as a teacher morphing into a trainer into banking and finance was very good.
That's great. And just that, so when you were doing the high school teaching, what subjects were you?
I was one of your old-fashioned home economics teachers. I taught cooking and sewing and I was the first teacher in New York to teach sex education. I was engaged to Stephen, and the kids would ask me very personal questions and I would not give them any answers. I went to Cornell School of Home Economics at the time. They called it home economics, and I loved it. And I still think I'm a really good cook today.
There you go.
When I do cook, pre-pandemic, we ate out a lot. Post-pandemic, during pandemic, we've been doing a lot of cooking together now. So yeah.
Nice. That's a nice bonding experience. Yeah, and it's great that you were able to take that teaching foundation into your career, that you were doing with the bank. So that's
loved it.
Good stuff. So just to kind of to close out here, I just want to talk a little bit about kind of your experience working with senior advisors. And, you mentioned, when Dr. Marcus was leaving his profession back in 2016, you had, trying to figure out what you're doing for health insurance, and you had come across us on the web, and fortunately, we were able to connect and kind of guide you through that process. I guess if you want to just talk about your experience a little bit working with us, whether if you remember that initial, conversation and kind of getting you set up, or anything since then that you want to chat about.
I think it was a very interesting experience because we were really a blank slate. I had no knowledge. My private practice in consultation, somebody else always took care of the billing and what have you. So I had no clue what it was all about. We spoke to you and you told us the various choices, get that out of
The
it,
very choices, yeah.
of types of plans. You were the only one that actually talked about Plan G, which was the one we eventually chose. And you said, you got to be crazy to use any other plan, do the math. And, saying something like that to me is a challenge. So I did the math and I said, this doesn't make any sense. Why is there anything but Plan G? The worst that can happen is that you have to pay the deductibles up to the maximum, and that's still less than it would have cost you the other way. So to me, it was a no-brainer. Everybody else that we spoke to, though,
Well,
denied there was even a Plan G.
in fact, most people defaulted to AARP
Yeah.
and went with United Healthcare. You gave us a menu. And we did a lot of math, and we did a lot of looking at it. We even spoke to other people, and we were kind of the first ones, I guess, to retire. And we actually had someone else that we knew locally, and he didn't even offer it. Had he offered a G, we might have gone with him because we're friends with them through our synagogue, but it wasn't offered. So you were honest, you were forthcoming. In fact, I think you came here and we visited. If I'm not mistaken, I think you did, because I have a feeling we sat in our den, and you were very forthcoming. If we had a question, you got back to us very quickly. And over the years, we still have emailed you with a question or two here and there. The last one was on dental insurance. Our son-in-law is a dentist, and if they're moving out of the area, which they might be very soon, we might need dental insurance now. Something we haven't ever needed, because my father was a dentist and my son-in-law is a dentist.
And at work, I had dental insurance.
And Stephen had dental at work. So, and every year, when you have us fill out the forms, looking at the Part D for our pharmaceuticals, you've been very honest about it. We've stuck with the same one pretty much the last couple of years. It goes up very small amount for what we have and what we use. So we've been very lucky there too, because both of us are in great health, which is a good thing. And
we hear a lot of complaints from other people about their
Coverage.
health insurance coverage.
We don't have any complaints.
Which is, I don't really understand it. Maybe we're just, luckily, knock on wood, healthy enough so that we haven't had that kind of problem.
Interestingly enough, though, one thing, the supplement we're using this year, nobody's ever heard of it. It is part of Aetna and CVS, but the name Ascendo doesn't resonate.
Right.
So I have to say to the people at the doctor's office when we got our shots and to go to Africa and all of that, it's a subsidiary of Aetna, CVS Health. Yeah, and you're saving us money this year. It went down. How many people can say that their supplemental went down?
Yep. Yeah, we revisited that. It was about a year and a half ago. We looked at that, and there was that new option came out for you, and it's the same coverage. I mean, it's just you just happen to be able to save some money on premium, and that's just the type of thing we're looking out for. Like you said, every year on the drug plan, because those do change every year. But then on the supplemental, when it makes sense, to keep the same coverage and lower the premium if we can do that. So
absolutely, and again, hopefully we stay healthy, and looking out for the future. I mean, we have less to look forward to than behind us in terms of age, but.
Well, you've got, like you said, you've got great coverage, basically 100% covered there for that small deductible there, about $200, and you're set. If anything does happen, you're in good shape. So I guess lastly, would you recommend us to your friends?
We have. You actually are working with our best friends who live in our development, who have a lot of health issues, and hopefully they have the quality of care that they need now that she is no longer working. So we have told other people about you. We have to tell people before they retire that they have to do their homework.
Oh, they need to work on it
about 18 months in advance. I really do think people need lead time. Don't let it creep up on you. Oh, I'll worry about it when. do your homework now.
Yeah.
Make sure you're working with
Yeah.
someone that understands your needs.
The killer, Justin, was the first year when we had retired, our adjusted gross income was so high that we got slammed by the Medicare penalties.
Because it's a 2-year prior, which we learned also, which we did not know.
Had we known that, we might have figured out a way to hide, to defer more
Yes.
more money,
Yeah.
In that last 2 years. So our adjusted gross income would have been lower. That's the only, I try to explain that to colleagues that are going to be retiring soon to do something about that at least 2 or 3 years before they retire. So when they're dependent on Medicare, they don't get slammed the way we do.
And hopefully Medicare will still be there. Again, we have Medicare, we have our Social Security, our pensions, and the money that we've put away for retirement. So
Yep.
And we're lucky.
Good stuff. Good
We're
stuff.
lucky.
Well,
Yeah. But thank you. You have been very responsive.
no, I appreciate that. And I really appreciate, like, once again, you both taking the time today to do this with me. And I want to thank you again for your business and the referrals. And, like I said, I'm just really glad you would do this with me today. And, we look forward to continuing to provide service for you. And obviously, if you have any questions going forward, you know how to reach me. And for folks out there that are looking for help with Medicare, that are watching this video, our number is also at our contact information is below the video. You can feel free to reach out to us there. And once again, I want to thank Dr. Marcus and Amy Marcus here for joining us today. So thanks again.
It was our pleasure. Thanks, Justin. Thanks for thinking of us. Take care.
Absolutely appreciate it. Take it easy. Bye-bye.
Bye.
Bye-bye.